Yeah,
Deanne, you're all
just
set?
copy 'em.
Okay. Bob, ready to go? We'll call this meeting of the Ways and Means Committee together today, Tuesday, December the 1st, 2015. Deanne, would you please call the roll? Here.
Kelly.
Here.
Durancer.
Here.
Duget.
Here.
Garrett.
Here.
Lutz.
Here.
Krieger.
Yes.
Warner present.
Thank you, Deanne. We've all had an opportunity to review the minutes of November the 3rd, 2015.
Support.
Moved and supported. Any questions or discussion on those minutes? Seeing none, all in favor?
Aye.
All opposed, motion carries. At this time, we'll allow for public input. Anybody that would like to address the Ways and Means Committee, please step to the podium and you can address the committee. Seeing no one's coming forward, under our next order of business, under petitions and communications, this one is going to be referred back to administration. This is the reorganization and consolidation of the responsibility of the Department of the Public Defender and Corporation Counsel. So we're going to
Motion to refer. Support.
moved and supported. Any questions or discussion? Seeing none, all in favor?
Aye.
All opposed, motion carries. Under B from the Bay County Treasurer, this is the annual review of the delinquent tax revolving fund.
So moved. Support.
Moved and supported. Questions or discussion? Seeing none, all in favor?
Aye.
All opposed, motion carries. Under C from the Drain Commissioner, this is the Kerr James Samansky Assessment Roll. I think this was redone because there was some inaccurate information.
So moved. Support.
Moved and supported. Any questions or discussion? Seeing none, all in favor?
Aye.
All opposed, motion carries. Under D from the Director of Administrative Services, this is the renewal of the property and liability insurance for 2016.
So moved. Support.
Moved and supported. Questions or discussion? Seeing none, all in favor?
Aye.
All opposed, motion carries. 911 under E is going to be the 911 Director. This is the Smart 911 system. Is somebody here?
No.
Oh, okay. I'm sorry.
Good afternoon, Commissioners. Chris is working Bay County Central Dispatch.
Thanks, Chris. You want to give folks a little bit of information?
Yeah, I just want to give you a kind of a quick overview of what Smart 911 is. Really briefly, what it is, it's a website, secure portal where residents can enter additional information about the residents, their family members, special needs information, right down to their pets, medical information, anything they have that's specific about them that they want to inform 911 about. So they can do that in a calm time when there's no emergencies going on. Log on to this website, it's secure, enter your information in. And when something occurs, an emergency, they can call 911, and that information will populate on the dispatcher screen. So we'll see additional information. Currently, we're really limited to location information, so we're going to see your cell phone number, your geographical location. If you're on a landline, you'll see your landline telephone number, your exact address, and then whoever is the primary person on that landline telephone number. That's the limited amount of information we'll receive. So residents who sign up for the application, and when we go live the first of next year, we'll see that additional information. So you can imagine maybe you have a severe allergy to medication, maybe peanut allergy, something like that, food allergy, and you call Central Dispatch and you're wheezing and you can't speak. We'll see that additional information, maybe you have a food allergy, something like that. And with that information forward to the first responders. It's about getting critical timely information in a quicker manner. Maybe you have children at home, things like that. And you can add their pictures, that kind of information. So maybe the individual is lost. Call 911 instead of spending time describing the size, weight of the child, what they look like. We can get that information right away from Smart 911 and push that information out to all the cars in the field too, so we can actually take that information, the image of the child, and push out the first responders. So it's really a way for residents to add additional information that they want to share with 911, and then we can see the information in a timely manner to assist them. It works in conjunction with Bay Alerts. So if you already have a Bay Alerts account, you just log back in your account, add additional information to the Smart 911 portion of the system, and you're ready to go. So when we go live, you call 911 and add that information. So for really takeaway for residents is that you've got a Smart 911 or a Bay Alerts account, log into your account, add the additional information for Smart 911. If you have yet to sign up for Bay Alerts, go to the Bay County website, sign up for Bay Alerts as well as the Smart 911 account and page, and you'll be ready when we go live with the system.
So, Chris, is there any other way Do you have to go to the county's website to get onto,
That's kind of the pathway in. We've got a webpage there for Bay Alerts, and we'll have something set up for the Smart 911 page as well. But because they're linked together, and that's a convenience to residents, it's the same system, two different components within the same system. Just go to the county website. The way I do it, actually, I just Google search Bay Alerts, Bay County, and it'll pop up
Okay.
and send it to the website.
all right. Does anybody have any questions for Chris? Doesn't seem any like Chris. Thank you very much for that information. With no other questions, all in favor?
Aye.
All opposed, motion carries. Under F, from the Supervisor of Buildings and Grounds, this is the purchase of some equipment.
Support.
Moved and supported. Any questions or discussion? Seeing none, all in favor?
Aye.
All opposed, motion carries. Under G, we have some payables from the general, bayonet, Center Ridge Arms.
So moved. Support.
Moved and supported. Any questions or discussion? Seeing none, all in favor?
Aye.
All opposed, motion carries. From the Finance Officer, under number 1, we have some budget adjustments.
So moved. Support.
Moved and supported. Any questions or discussion on the adjustments? Seeing none, all in favor?
Aye.
All opposed, motion carries. Under number 2, we have an amendment to the EFT Resolution 2014-181.
So moved.
Support. Moved and supported. Questions or discussion? Seeing none, all in favor?
Aye.
All opposed, motion carries. We have under 3, the analysis of the general fund equity for 2015.
Support.
Moved and supported. Any questions? Seeing none, all in favor?
Aye.
All opposed, motion carries. Under 4, we have an update regarding the Executive Directive 2007-11.
Motion received. Support.
Moved and supported. Any questions? Seeing none, all in favor?
Aye.
All opposed, motion carries. Under number 5, we have a golf course fund. This is a short-term loan.
So moved.
Moved and supported. Any questions? Seeing none, all in favor?
Aye.
All opposed, motion carries. Under I, we have the director, or the housing director for Center Ridge Arms. This is the renewal of the property and liability insurance.
So moved. Support.
Moved and supported. Any questions or discussion? Seeing none, all in favor?
Aye.
All opposed, motion carries. Under J, from the Gypsy Moth Coordinator, number 1, this is the treatment of ash trees to control the emerald ash borer.
So moved.
Moved and supported. Questions or discussion? Seeing none, all in favor?
Aye.
Motion carries. Under 2, we have the treatment to control the outbreak level populations of the gypsy moth with an aerial applicator.
So moved. Support.
Moved and supported. Any questions or discussion? Seeing none, all in favor?
Aye.
All opposed, motion carries. Does anybody have anything under any referrals? Any unfinished business? Under new business, we've got 2 resolutions. The first one is, does that have a number, Deanne, or it? Okay, this is going to be for an emergency purchase of an X-ray machine for the Sheriff's Department.
So moved. Support.
Moved and supported. Any questions, or Commissioner Tilley?
Is this at the courthouse? And they come
Yes.
in, they need a new machine?
Yeah, it blew up. It's lasted,
Do they contain the radiation? Or?
yes. It's lasted over 3 years more than it was supposed to, so.
Very good. Thank you.
All right. Any other questions or discussion? Seeing none, all in favor?
Aye.
All opposed, motion carries. The second one is going to be the remonumentation program for 2016.
So moved.
Support. Moved and supported. Any questions or discussion? Seeing none, all in favor?
Aye.
All opposed, motion carries. We do not have a closed session. Commissioner Krieger.
I'm waiting for miscellaneous.
Oh, miscellaneous. There you go.
Joel, just something I want to bring some attention to. Last week, Joel and I attended a meeting at Bangor Township, and one of the discussions there was about an expansion or to further upgrade a park that's there off of Bay Shore in Bangor Road. And the question that came up was the spoils that was allowed to be dumped into this site is adjacent to homes in the area. One of the concerns that came out that I was called on with health issues and concerns, being that there was these spoils that were dredged out of the lagoon and also the Collin River. And this project, I believe, goes back to like around 1990 or 1999. And so Joel and I, and Laura Olgar is looking into some stuff also on whether or not there was testing done of these spoils and what was actually in the spoils themselves. So Joel, I'm just kind of bringing you up here a second. Is there anything or have you come across?
I have not come across anything yet. Also, we haven't looked into it extensively. We're also going under accreditation this week in the health
Okay.
department. So, but that being said, we're going to look into it, what DEQ has. I believe that the administration has already been in contact with DEQ.
Well, my understanding, just to cut in here a second, my understanding from DEQ, they don't have any records of any soil samples. So I think what's going to happen is maybe the administration will have to do a FOIA to find that information to see what's actually in there. As well as maybe touching base with Mr. Ribbett with the Drain Commission, because I know back when this was all done, Joe Campbell was the supervisor for Bangor Township. I'm not exactly sure if it came into the time when Joe Ribbett then became a supervisor, but there are a lot of concerns by these homeowners that live adjacent to this area, and so I want to make sure that this doesn't fall through the crack, that we find out what was put in there, and if nobody knows, and I certainly would hope that Bangor Township would take the lead in getting those soils tested, so we know that it is indeed safe.
I do have a call into the Michigan Department of Health and Human Services. They have done some extensive testing with some of the other spoil sites to get good knowledge and ascertain what an estimate of the price of that would be as well. I know when they did this along the Tittabawassee River, and they did this in part of the spoil site off of the Saginaw River, it was quite a costly endeavor. And so part of the thing is we do have to call into MDHHS in their Toxic Substances Bureau to determine, just what a ballpark price of what this would be. It would probably involve several samples, not just one.
Correct. Well, I would think the agencies that oversaw this deposit into this area should be responsible for those samples, and then it shouldn't be a cost incurred by either Bay County or Bangor Township, especially when it deals with the health and welfare of these individuals. And I think the ones that would be most affected by these spoils would be the young and the old. So I want to make sure that we do whatever we need to do with your office, the DEQ. Tom, I know that you've sent out paperwork on the spoils there. And you have a memory of history that goes all the way back, so we might have to tap into that a little bit so we can find out who the parties were that allowed for those spoils to be put in that specific area when you have homes all the way around it. So that's mine in a nutshell. Thank you.
Okay, we will look into it and have some more definitive information in the coming weeks.
Okay.
All right, thanks. You all set, Commissioner
Yes.
Krieger?
Thank you.
Commissioner Durancheck?
I have a question for Chairman Krieger. Are these people serviced with water, municipal water, or are there some wells?
No, they're all on city water,
Okay,
but some of the homes have sump pumps.
yes.
And they've got water leaching in that is
Yeah.
questionable. And there's been a number of residents that have had issues with their health. In one particular family, both the husband and wife have the same disease, which is kind of unusual for that to happen in one household. And since that was brought to my attention, the husband has now died and the wife is still battling the issue. So I'd like to bring some information to these homeowners to kind of put their mind at ease if indeed there's nothing to be worried about. And if there is something to be worried about, then we need to take action
You bet.
and get it taken care of. Thanks.
Thank you. You all set, Commissioner Durancheck? Commissioner Tilley?
Just, Ernie, I don't know if you saw in the paper yesterday, in regards to this rock snot and this mud snail that they've, an invasive species they found in the UP in cold waters.
Oh,
So I'm curious to see how the DEQ handles this going forward in comparison to some of the issues we've battled here. In reading the article, 1 microcosm of this sludge can reproduce itself. So they have to clean everything out in order to stop it from spreading. It'll choke out the natural algae that is in the UP.
And I'm assuming it came over in ballast water?
That's the assumption. They're doing more research on it now, but it's pretty mucky. Anyway, so it's something maybe we should follow and see what progress they take on that, how fast they act on that versus how slow they've acted here on our stuff.
Thank you. All set, Mr. Commissioner Tilley? Commissioner Beget?
A different topic, but for Joel also, about heroin, we talked about that briefly before, and so far there was a 1 session on heroin, and then McLaren had another one, and there's another one coming up, and I'm trying to remember if it's the 8th or the 15th, that the prevention network is running. So, you know, there's people looking at it, and they're trying to figure out what we can do about it.
The discussion or the meeting on the 15th is another community discussion on opiate use and heroin. Beginning in January, we are working with Bay Area Behavioral Health and the working group that we gathered so far with law enforcement. And we're actually creating a task force to have a comprehensive strategy. And as I said before, it's a 3-pronged strategy. Number 1 is law enforcement. We know that we don't address the problem away, but it's definitely a law enforcement issue, and it has issues in regards to crime that's spilling into local neighborhoods. It's a treatment issue that's probably most important. A lot of these folks need inpatient treatment, which they can't currently get right now. There are some options locally for outpatient treatment. But as the problem becomes more intense, the slots for those outpatient treatment fills up. And then finally, it's a public health issue and a community issue, and we want people to realize what's going on with that. As you see today, we asked for more money for autopsies. That's directly related to the number of overdoses. And we're also tracking other diseases too, primarily hepatitis C and HIV, because we are starting to see slight increases in hepatitis C. We do not want to see at all an increase. Well, we don't want to see an increase in hepatitis C at all, but we don't want to see an increase in HIV either. And a good example of why we're worried about that is in southern Indiana, a rural community, this year they had a major HIV outbreak for 100 people. And just to kind of give you some background and knowledge of that, we typically only see about maybe 35 cases of HIV here in Bay County per year.
And the meeting, where is that taking place on the 18th?
On the 15th?
Yes.
The 15th is at the Lincoln Center. I believe it's RSVP,
Oh, it's already-
but it's already filled up. So.
Okay.
All right, hang on just a second, Joel. Commissioner Durancheck.
I have, just within the last couple of hours, we have set up, sorry I didn't have time because I had to come to this meeting, but we just set up a meeting, a summit up in Pinconning. We have the Pinconning Junior Middle High School gym for January the 12th. So I'm going to be emailing you, but just to let everybody know, so we're going to do the same kind of thing up north and kind of spread the word. So that's Tuesday, January the 12th. It's going to be an evening presentation.
All right, thank you, sir. Anybody else have anything for Joel? Commissioner Tilley.
Well, Joel's here, is that, we haven't seen an HIV uptick in this country since 2002. And since 2013, we've started to see the first uptick since that time.
Yes.
And there's a direct correlation to sharing of meals and heroin, and that's the danger that lurks behind all of this, is that one leads to the other, which leads to the other, and the next thing you know, we've got an epidemic going here. So I think that we can do what we can to nip it in the bud before it gets too bad. We appreciate your efforts.
Thank you.
Anybody else? Okay, anybody else have anything under miscellaneous? Any announcements?
Motion to adjourn is always in order.
Support.
All in favor?
Aye.
All opposed?